Secretary Sebelius, thanks for coming on KTNV. I should mention that you're here campaigning for Hillary Clinton, and it's part of her jobs tour. And I'm wondering, some people would say, especially Republicans, you're the worst messenger for this because Obamacare has been terrible for jobs, especially the so-called involuntary part-time worker jobs. What do you say to that?
Well, I would just say they're wrong. The predictions were that Obamacare would kill jobs, and just the opposite has happened. There have been 15 million new private sector jobs added in the Obama administration, and month in and month out, healthcare is one of the key areas that leads the job boom. Tech industries related directly to healthcare are part of leading the jobs boom. So the economists all dispute the fact that any jobs have been lost. What has happened, which is, I think, very good news, is some workers who may have had job lock, couldn't start their own business, couldn't choose to do something else because they were terrified of losing their insurance, now have some options. And people have an opportunity, if they have the means and want to retire, they're not terrified that they won't be covered either. So it has freed some people in the economy to make choices they couldn't make before. But there is absolutely zero evidence that part-time work has increased with this bill, or that people,
that part-time workers have increased.
Actually, since the recession, people were initially, a number of them were brought back part-time, but now that is increasing to more and more full-time jobs. And as I say, 15 million private sector jobs.
I guess what I'm wondering, though, is that you don't think that some employers have put workers on part-time status to try to get around the 30-hour requirement? You don't think there's any evidence of that at all?
Well, at least, I mean, I've followed the Economist reports pretty closely because that was one of the big accusations. Not only that, but the accusation also was that employers would dump their coverage, right? And that many more people, that has not happened. The employment job market actually has stayed very steady with employers keeping health care benefits as a way to recruit and retain workers. It's always been a great benefit. It continues to be a great benefit. So again, the segment of the economy, those who were purchasing their own coverage, working in a mom and pop shop that didn't have employer-based coverage, now have an option that they didn't have before, have some protections that they didn't have before. But there seems to be, John, very little evidence that jobs have been lost because of the health care bill. And if anything, as I say, the healthcare sector, including the last jobs report, continues to lead the way in new jobs created.
Well, one thing that's clearly true, Secretary Sebelius, is that there's one of the lowest rates of uninsured in this country. I think it's at 9% now, around there, lowest in a long life. There's no question that part of it has worked. But there have been a lot of reports of planned premium increases for next year from major insurers. What about that?
Well, again, we're talking about a slice of the marketplace where if you look at the 10 years before the health care bill was passed, year in and year out, there were double-digit plus increases. The average increase was 10%, usually in the 12 to 15% market for this portion of the population. Not people in big employment plans, not people in government plans, but for the 8 or 9 million people shopping on their own, trying to get their own coverage. They not only had these huge increases, but insurance companies could pick and choose. We don't want you, Jon Ralston, because you have a pre-existing health condition. We will charge you, Kathleen Sebelius, twice as much as your male colleague because you're a woman and you might someday get sicker or get pregnant. Those days are over. So the good news, I think, for people is, yes, there are increases being planned.
Significant. You acknowledge significant.
Well, some of the plans in some of the markets are planning significant increases. What again is happening, though, is we are still well below what the Congressional Budget Office said the premiums would come in. A lot of insurers were frankly bidding blind. They didn't know who would sign up, who would come in, and I think there will be some rate increases. But frankly, it's one of the things Hillary Clinton wants to do is have more rate oversight. You know, in one of my former lives, I was a state insurance commissioner. We actually were pretty rigorous about looking at proposed rate increases from companies, often denying them or cutting them back. In states that are doing that, rate increases are much lower. In states where There have been encouragements to companies to come in, a lot of enthusiasm about signing people up. Rates have stayed a lot lower, and there's a lot more competition. So I would say also there's some real kind of responsibility at the state level, hopefully, to step up. That's still where insurance rate regulation rests.
There's been, I think, to be fair, mixed results here in Nevada. There were problems with the website here. I don't want to bring back the flashbacks for you. Yeah, exactly. But there's been the co-op, as you probably are aware here, closed down. The governor here did expand Medicaid, even though he's a Republican governor. But the results here have been mixed. Can you say today, sitting here, that you believe that the Affordable Care Act has been a success?
Well, I think it has been a start of a success. There's clearly work to do, and that's why I'm enthusiastically supporting Hillary Clinton for a whole variety of reasons, but one of them is health care. She has some very specific plans about going after the high price of prescription drugs, which is impacting everyone. Ways to actually make sure that out-of-pocket costs aren't bankrupting families, even though there's finally a ceiling. It's still too much for people who don't have a lot of out-of-pocket money. Ways to stabilize these new marketplaces. She also would like a public option to be part of the plan. That's really what the plan was supposed to include in the first place. There weren't enough votes for that. The co-ops were sort of a Hail Mary pass to try and get some competition. Some of them have succeeded, a number of them have not. It's hard to start a brand new company.
That's just a promise, though. I mean, she just said that because of Bernie Sanders, don't you think?
Well, I think she has very specific plans about Medicare buy-in for the plus 55-year-old.
That's not the pure public option, though,
but
right?
You could expand that to a larger age group. And for 55 to 65-year-olds, that would be a huge opportunity to, again, stabilize some of the exchanges. So I think that exchanges are young for an insurance plan, but there's no question. I get stopped every day, John, by people in grocery stores, on airplanes, walking down the sidewalk, who come up and say to me, I'm the parent of a special needs kid. I never thought my child would have insurance. I couldn't get coverage. My favorite diner in Lawrence, Kansas, the woman running the diner, Meg, is running the diner because she has a pre-existing condition, but she could finally get health coverage so she could start her own business.
No one ever recognizes you and says nasty things to you? Is that what you're trying to have me believe?
The nasty things stopped with Congress.
Oh,
so
did they?
it now...
That's where all the nasty people are anyhow. You know, one thing I wanted to ask you about the Obamacare that has a local angle is the excise tax, which, you know, the union here, the culinary union, Parent, the Unite here, they objected to that almost from the word go. We're very frustrated with the Obama administration. Now, they actually pushed Hillary Clinton. I think they're partly responsible. She wants to repeal it now. There's proposals, of course, to delay it in Congress. In the Democratic platform, there was a piece in there, you've probably seen it, that says we want to repeal the excise tax or the Cadillac tax and find a way to replace that revenue that does not hurt working people. Was the excise tax a mistake?
I don't think it was a mistake. I think, and I'm hoping that what happens is not a total repeal, but some kind of alternative option.
Like what?
Well, I think the whole point was it was an alternative to people who said employers shouldn't get any tax credit for offering health care in the future. That would have destroyed 180 million Americans' health plans if employers no longer got a tax benefit. So what the Obama administration said, and Democrats supported at the time, let's pick a date out in the distance. Let's tax just the portion of a plan that's above an average. And it has indeed changed some of the dynamics. I still think kind of bending the cost curve, lowering the overall cost makes sense. So I'm eager.
The idea makes sense, don't you? I mean, be honest, you like the idea.
Well, I think,
and so did the Obama administration for a long time.
I think it's important to look at ways to lower overall costs in the long term and not hurt the people who are supposed to be benefited. I think I had the opportunity today to spend some time with Catherine Cortez Masto, who I think will be a great replacement for Harry Reid, and pick up that baton.
That was very smooth, by the way, for people. You worked her name in here. I'm very impressed. You got Hillary Clinton twice and her once.
Well, I think working with President Clinton, working with supportive Senate members, including a new Senator Masto, we would have the opportunity, finally, to make some improvements in the law. The law is nowhere near perfect. But for the past 6 years since President Obama signed the law, the Congress has refused to make even the smallest administrative changes. No law survives like that. Medicare today, which is wildly popular, looks nothing like it looked when it was passed when my father was in Congress and voted for it.
Right.
So we need an administration who actually says, we've made a big step forward. 20 million people have coverage. We have the lowest rate of uninsured. We have 8 million children with health insurance. We don't want to go back. We don't want to wipe out the Nevadans who now have health coverage. We need to go forward, address the high costs, address the out-of-pocket costs, go after the cost of drugs, which is bankrupting people, and look at ways that we stabilize and improve this.
Well, but repealing the excise tax, which was a well thought out, and I know the president defended it for a long time, piece of the policy. If you repeal that, which you don't seem that enthusiastic about doing, if you do though, you got to replace that money, do you not?
That's right.
And what are the alternatives to doing
well,
that?
there were ways at the time to look for additional funding, and the pay-fors that Congress comes up with are always sort of magical to me.
But
I
how
don't
do you do
pretend
it? It's not an insignificant amount of money.
Well, I think that would be one of the conversations that would have to take place. Is what are the ways to make sure that you don't put a big hole in the act. And I think the goal, and I think the Culinary Union and others would support the ultimate goal, is how do you bring down the overall costs without hurting people? And I would very much support that. I do think this was the more reasonable alternative to totally abandoning, which John McCain supported during the '08 campaign, totally abandoning tax credits for any employer offering health coverage, which would, I feel strongly, have destroyed the employer-based market. The president chose to fill the gap, not to start all over again, and that's, I think, where Hillary Clinton administration would pick up, how you move forward.
We have a few minutes left. I want to talk to you about the overall atmosphere in the race. I mean, there's been I think a lot of people, including myself, who have covered politics for a long time, are really astounded by what's going on in this race. With the most recent thing, of course, Donald Trump's remarks about the Second Amendment. When you're shaking your head, I think any reasonable person would shake their head. But I think what's frustrating and even scary to some Democrats is they think, my goodness, if we had a candidate who didn't have the kind of disapproval ratings, the kind of lack of trust from the American people that Hillary Clinton has, we wouldn't even be worried about the election. Does that concern you? I mean, you're an enthusiastic supporter of Secretary Clinton, I know that, but so many people don't trust her. So many people have this visceral distrust, right? They're so imbued with it, they can't be taken off of it. Why do you think that is?
Well, I think that we're, again, in a partisan situation. I'm frankly appalled by the number of thoughtful Republicans who say at the end of the day, we're going to put party over principle. We are going to vote for a candidate we abhor, his ideas. We don't stand by his values, but we're going to vote for him anyway. That I find to be, frankly, very frightening when the candidate on the Republican side doesn't, I think, share fundamental American values, doesn't value a free press, doesn't seem to believe in the freedom of religion and the kind of separation of church and state that's fundamental to this democracy, does not, has gone after women, has gone after vulnerable candidates. So I guess my focus is on, why do we have races that are as close as that? Why can Joe Heck, who is a former military man, abide by a candidate, stand by a candidate who attacks a Gold Star family? How does that work in this day and age? And I just
he's a current military man, by the way. But still, forget about Joe Heck for a second. Everything you said about Donald Trump, I agree with, and I agree with you about thoughtful Republicans. I've written a lot about it. But you also have a candidate you're supporting who the FBI director essentially all but said, I almost indicted her. Now, you're not going to like that characterization, but that's essentially what he almost said, that people think that what she did was at the very least arrogant and careless, and maybe at the worst criminal. This is a person you're supporting, and a lot of Republicans would say, you know what, I don't like Trump, but I can't support her because she is a borderline criminal. How do you respond to that?
Well, I respond by saying one of these two people will be elected president. One of the two people will be commander-in-chief of the United States. And yes, indeed, the FBI director said Secretary Clinton was extremely careless. She has said herself it was a huge mistake.
Does it bother you
Does it
bother you?
Sure. I think people make mistakes. Do I think she is prepared and ready to be president? You bet. Do I think Donald Trump is prepared and ready to be president? I absolutely do not. And I don't think the next 90 days will get him there. So that's our choice. That is our choice of candidates. One of these two people will be sworn in on January 20th as the next president of the United States. And I think what you're seeing now, John, is a series of Republicans, of leaders, of national security advisors, of economic advisors saying this is dangerous for our country. It is not the values we believe in. Our children and our grandchildren will look back on this day and say, where were you in the election of 2016? Who is it that you stood by? And I don't think there's any question who is prepared to be president, and that's Hillary Clinton.
Secretary Sebelius, I really appreciate your willingness to come on KTNV. Thanks.
Nice to be here.
All right. Thank you.